I never imagined a simple rash could turn our world upside down. It was Saturday morning when I noticed it, small red blotches across my 7-year-old daughter Lily's arms and chest. At first, I thought it was just an allergic reaction to something she'd eaten, or maybe a new detergent on her clothes. But by the evening, the rash had spread, and Lily complained that it was itchy and uncomfortable. Her cheeks were flushed, and she seemed unusually tired. I knew then that this wasn't something we could ignore. I rushed her to the nearest hospital, my heart pounding in my chest. The emergency room was busy, full of groaning patients and tired nurses, but they quickly ushered us to a small examination room. The doctor came in, clipboard in hand, and examined Lily thoroughly. He asked a series of questions about her symptoms, her recent meals, and any medication she might have taken. He nodded thoughtfully and said he'd call a nurse to check her vitals and take a closer look. The nurse, a woman in her mid-40s with a calm but serious demeanor, smiled at Lily and told her everything would be fine. She took Lily's temperature, pulse, and blood pressure, then stepped aside. "Can I speak with you privately for a moment?" she asked, her tone unusually grave. I felt a lump form in my throat. "Of course," I said, my voice shaking slightly, and followed her down the hall. She led me to a quiet corner near the nurse's station, away from the buzz of the ER. She looked at me with eyes that seemed to carry a weight far heavier than a simple rash should warrant. "I'm going to be honest with you," she began. "Rashes in children are common, yes. But the pattern of this one, combined with some other symptoms your daughter described, concerns me. I don't want to alarm you unnecessarily, but we need to consider the possibility of something more serious." I felt my stomach drop. "More serious? Like what?" I asked, though a part of me already feared the answer. She took a deep breath. "I don't know for certain, and I'm not a doctor, but I've seen cases like this before. Sometimes a rash like this can indicate an underlying infection, a reaction to something internal, or, in rare cases, something that affects the immune system. I need you to pay close attention to any changes: fever, unusual fatigue, swelling, or difficulty breathing. These are red flags. The doctor will need to run blood tests and possibly other diagnostics to rule out anything dangerous." Her words hit me harder than I expected. I had gone in thinking this was minor, just a rash, maybe some itching and a little discomfort. But hearing the nurse speak so seriously privately made my heart pound in a way I hadn't felt since Lily was born. "Okay," I whispered. "I'll watch her closely. I promise." She nodded. "Good. And one more thing, trust your instincts. You know your daughter better than anyone. If you feel something is off, don't wait. Come back immediately or call for help. Children can deteriorate quickly when it's serious." I swallowed hard, nodding again. The nurse gave me a reassuring pat on the shoulder before heading back to her duties, leaving me alone with my thoughts. I walked back into the room where Lily sat, coloring quietly, unaware of the storm brewing in my mind. Her innocent smile and the way she clutched her coloring book made me feel both protective and helpless at the same time. The doctor returned shortly afterward with orders for blood work. He explained that while the rash might be harmless, it was important to rule out infections like strep, viral illnesses, or even something related to her immune system. The tests were routine but necessary. As Lily sat on the examination table, nervously fidgeting, I held her hand and tried to smile, even though my mind was racing. Hours passed in a blur of waiting, forms, and small reassurances from the nurses. Each beep of the monitor and each time the doctor came and left added to my anxiety. The nurse who had spoken to me earlier checked on us occasionally, giving me subtle nods that said, "I'm keeping an eye on her." Finally, the results came in. The doctor walked in, his expression serious but not alarming. "The good news," he said, "is that this is not life-threatening. It appears to be an allergic reaction, most likely triggered by something Lily ate recently. There's no infection, no underlying disease. We'll give her some antihistamines, and she should recover fully within a few days." Relief washed over me, almost bringing me to tears. I hugged Lily tightly, feeling the tension in my chest finally ease. But even as I felt the relief, I couldn't shake the memory of the nurse's private warning, her serious eyes, and the quiet corner where she had prepared me for the possibility of something much worse. That night, as we walked home from the hospital, Lily holding my hand and skipping a little to shake off her discomfort, I realized how fragile life could feel how quickly something ordinary could become frightening. I felt a deep gratitude for the nurse who had taken the time to speak to me privately, for the doctor who ran the tests, and for the little body of my daughter that had endured so much without complaint. I made a silent promise to myself. I would never take her health for granted again. And more importantly, I would always trust my instincts as a parent, because sometimes, even when everything seems minor, a parent's intuition can be the difference between preparation and panic. That rash, which had seemed so trivial at first, became a turning point for me. Not just in awareness of my daughter's health, but in understanding the depth of love and vigilance that comes with being responsible for another human being's life. The nurse's words, whispered in private, had changed everything. Not because the situation turned out to be dire, but because they reminded me how quickly life can shift and how crucial it is to pay attention, to act, and to care with unwavering focus. And as Lily laughed softly beside me, already forgetting the ordeal, I felt a renewed sense of devotion, a reminder that even the smallest warning signs could hold the power to change everything.